lot has changed recently with the pandemic. We have a new age group able to get vaccinated. Numbers have changed as well. Now's a good time to review what you need to know to stay safe. To do that, we have Dr. DeAnne Brooks from Cone Health. She is the Chief Pharmacy Officer, and she can break down all kinds of things that you need to know about COVID. We're going to review all the things and also get you new information. All right, so let's first and foremost kind of talk about who can get the vaccine and who should get the vaccine.
So we're very excited that now everyone who is 6 months or older is eligible to receive a free and safe and effective COVID-19 vaccine. And so really, if you're eligible for it and you are 6 months or older, parents can bring their children to their pediatricians. Everyone can be protected from the severe effects of COVID-19.
All right, let's kind of zero in just on this vaccine for the youngest of them. What do parents need to know about this newly approved vaccine for kids under 5?
Yes, so what you need to know are the vaccines have been proven to be safe. They have been tested in thousands of children, and many vaccines have already been given to those 5 years and older, millions actually. And the dose is a little bit smaller than what it is. The greater than 6 month to 5-year-old dose is a little bit smaller. It's a different dose. Typically, it's given in the thigh rather than the arm. And the other thing to know is you can still get side effects, just like we get side effects and children get side effects from other vaccinations. And that's typically soreness at the injection site, which again is typically in the thigh for the really younger kids. And might get a little bit of swelling there, could get some fever, a headache, just feeling yucky for up to a couple of days after getting the vaccine. And then the way that you can make an appointment, Cone Health has 4 pediatrician offices that are offering the vaccine to the children who are greater than 6 months old and greater. And you can go to our website, conehealth.com/vaccine, and you will see the phone numbers for those offices, and we ask that the appointments be made directly with those offices. In addition, you can also go to vaccine.gov and look for other options for where the vaccine can be administered.
Mm-hmm. And you did say that the vaccine's a lower dose than what would have been given to the older kids. So some of the vaccines are 2, some of them are 3 series.
Correct, yes. For the greater than 6 months and older age group, the Pfizer vaccine right now is authorized as a 3-dose series, and the Moderna right now is authorized as a 2-dose series.
Okay, and you want to keep that in mind because really your child is not fully vaccinated until they finish all of the doses, and then usually like a week or 2 after. So if you want them to be vaccinated before they go to daycare or something like that in the fall, you want to get a move on with that. All right, so if a parent is hesitant though to vaccinate their child, what recommendation do you have?
Say that one more time, Tanya.
Mm-hmm. If a parent is hesitant, and we've seen this before, and we've seen this all through COVID, if they're hesitant to get their child vaccinated, what do you recommend?
Sure. What I recommend is having a conversation with their pediatrician, and they can also have a conversation with their pharmacist as well. But really, for any hesitancy that a parent has, I think it would be really helpful to speak with their trusted healthcare advisors. We do know that these vaccines prevent serious illness and hospitalization and even death.
All right, so for those of us who have had vaccines and this, that, and the other, and they're like, oh, do I need that booster? Do I not need that booster? Who can get the booster now, and how is it important for you to do that?
Sure. So anyone who's had the Pfizer vaccine who is 5 years old and older is eligible for a booster now. And if you are greater than 50 years old, you actually can get an additional booster, which would be 4 doses. This is for most people. For the Moderna vaccine, anyone who's 18 and older can get a booster of the vaccine, and then same thing, if you're greater than 50, you can get another booster.
All right, and so like I had the J&J, and I did get one booster, so does that mean that I'm able to get a second booster?
Yes, you could get another booster now. And the other thing to keep in mind as well is that people who are immunocompromised, so their immune system is not quite as strong as others, there's different dosing that were actually just additional boosters that can occur for those folks.
Okay, and so much we've been talking about the vaccines, and we're getting kind of back to whatever normal is with, the vaccine and all that kind of stuff. Are masks still even a thing that we need to deal with?
Yeah, so it really depends on your situation. And I think that, yes, if we are in a public area, particularly right now with these Omicron variants that are highly contagious, if you're somewhere, particularly if you're inside and there are a lot of people around, I think it's just smart to wear a mask. It's not required, but anyone can wear a mask at any time that they want to. And it's also helpful to see if it's high in your community right now, you can certainly wear a mask. And then if you're going to go see someone who might be immunocompromised or very elderly, if somebody's going to see their grandma and they know that they were out in a big crowd but weren't masked and they want to make sure that they don't get COVID-19, it would certainly be appropriate to wear a mask and a smart thing to do.
Okay. All right, so now it is your chance to ask Dr. Brooks your questions. And so this is how you do that. You text us that question. The number is 336-379-5775. We'll be right back.